In today's video, I'm going to go through all of the rehabilitation that you need to know in the latter stages of your knee replacement. So make sure that you keep watching until the very end because I'm going to tell you how to get as much strength and movement back in your knee as possible. And I'm going to start right now. Now, just before we get started, if you have stumbled across this video whilst looking for some exercises to do for your knee replacement from day 1 post-op to that 2 to 4 week post-op period, then you'll be pleased to know I have put a video together on the early exercises that you need for your knee replacement, which you can find in the description below the video, and you can always head over to the Genuine Physio YouTube channel. But do stay tuned because you will need these exercises in this video very soon. Now, if you have watched the early stage exercise video, then thank you very much. But what you will notice is a lot of the movement exercises are actually quite similar. The difference here, however, is that in the latter stages, so weeks 2 to 4 plus, when we know that the dressing has been removed, the wound is looking nice and healthy and it's healing well, you have to be quite aggressive with the stretches. Essentially, what we're trying to do is get the joint to the end of range and then apply some passive pressure. Now, because of that, they will not be comfortable, they will be painful, and they will not be fun. So it will be up to you to manage your pain relief appropriately. The recommendation would be to take your pain relief 20 minutes to 30 minutes before you do your rehabilitation so that you can push that bit harder. The first exercise we're going to do is to try and get more bend in the knee. So we're going to do a knee flexion. So you're going to bring your heel slowly up to your bottom. You can use your hands as your passive overpressure, or if you have a towel at home you can use, grab either end of the towel, wrap that around your foot or your shin, and you can use that to pull your leg back up and then slowly lower down. Bring the knee up. Add your overpressure, and at this stage it is likely to be uncomfortable. Make sure you keep taking calm, deep breaths in and out. That can help with the pain. Another couple of things you can try to help with the pain is add in some distraction. You may want to listen to an audiobook, some music, or you could even have the television on in the background. Another movement exercise that you can try on the bed is to try and get the knee more straight. Grab your towel, roll it up, pop it underneath your foot, and this time you're going to push the knee down. But again, we want some overpressure. You can physically push down on your thigh to try and get that knee more straight, and then ease off. And then again, push down, hold for a few seconds, and then ease off. Back to our bending exercises. And for this one, you need a chair with a hole underneath. So a dining room chair would be perfect. Now with this one, you're going to bring your unaffected leg in front of your affected leg, and this is the one that's going to be doing the work. You're going to pull on your affected leg with your good leg and see how far you can bend it back. At this stage, it is likely to feel tight and uncomfortable. Keep taking those deep breaths in and out, and then slowly ease off. And then when you're ready, you can use your unaffected leg to pull the knee back and see how much bend you can get in that knee. And as before, when you get to the end of the range, you can hold for a few seconds until that pain starts to subside. Now, whenever you're sat down, little and often try and get your knee as straight as possible. Find yourself another chair or a stool at home that you can pop your foot on with nothing underneath the knee. The idea is we're letting gravity bring the knee down, and again, it is going to feel slightly uncomfortable, so try and hold this position for as long as you can tolerate. After a while, you can bring it back down, stretch it out, and then put it back up again. If you're finding that that is tolerable and you can progress the exercise, then I have a few props. Now, apologies, this is not the cleanest, but we have some oven mitts. Place that over the knee and some Heinz baked beans, very posh. Pop those in either side, and that's just going to give you some additional weight to bring the knee down and stretch out the back of the leg even further. Apologies, I'm interrupting just for a second to say if you are enjoying this video and you would like to know more about osteoarthritis and all other things of pain and rehabilitation, then hit that subscribe button so you get notified every time I release a new video, which I do every single week. Thank you very much for watching and enjoy the rest of this one. Another way that you can try and get your knee more straight whilst you're sat down is do a hamstring stretch. So bring yourself as far forwards on the chair as you can, straighten the knee, heel on the floor, toes towards you, and then gently lean forwards as far as you can. And at some point down the leg, you will feel a strong stretch in the back of the knee, and you can hold that for anywhere up to 30 seconds intermittently throughout the day. In the early stage video, we did this without any resistance, but we need to work on our quadricep strength. So we're going to progress onto some resistance in the form of a band, or if at home you have some ankle weights, then they would be perfect as well. You're just going to make yourself comfortable and then straighten your knee, hold for a second or two, and then slowly down, and then straighten the knee, and then slowly down. The next exercise we're going to try is a squat. Now that may sound daunting after a knee replacement, but it's a really important exercise because it's a similar movement to that you do every time you get out of a chair. Now you can start off with a very, very small movement and you will be able to do it and then just progress gradually as you feel comfortable. You can use a back of a chair or the kitchen surface at home for some support, but start off, like I said, with a very small movement. So feet you want just hip width apart. Hold on to the surface in front of you, don't lean on it, you want the weight going through your legs, and then you're just going to do a very small movement. So you're aiming to stick your bottom out, your bottom is aiming for that chair behind you. Now if you want to do just 25% of the movement initially, that's absolutely fine, and then as you feel more comfortable, you can go slightly lower and slightly lower. Now, this might look a tad daunting as well, but I promise you'll be able to do it as long as you feel safe and you've got adequate support around you. So I've obviously got the back of two chairs. You could use the kitchen surface in a chair, dining room table and a chair. Take a big step for your split squat. Try not to take a small step, otherwise you will be off balance. Big step, and exactly the same as the squat. Just start off with a very small movement and then you progress as you feel comfortable. So start off with the knee straight. This will help get your knee more bent and it will help the strength in your thigh and your glutes. So you're going to lower yourself down, come back up, lower yourself down, come back up. And like I said, as you get a bit more confident, you can go slightly lower and slightly lower. Progressions would be getting rid of one chair and holding on with one hand. And then when you feel really confident, you can get rid of both. Stairs are another thing that people will struggle with if they've had a knee replacement, so they need to be practiced. So find your bottom stair at home, make sure you're holding on both sides. Again, you need to feel safe. And then you're going to place your affected leg on the bottom step, and all you're going to do is push up through that leg and back down. Starting off with a very small movement, and back down, and then when you feel confident you can push all the way up and back down. Coming downstairs will also need to be practiced, but it is more challenging because you need more strength and you need more range of movement at your knee and your ankle. So you might want to try this after you're comfortable with going up. So again, bottom step at home, have both feet on the step and the affected leg is going to do the work. So start off doing a very small movement on that one leg and then back up, very small movement on that one leg and then back up, holding on the whole time. And then when you feel more comfortable, you can start moving through slightly more range. Your calf is also likely to be quite a lot weaker after you've had a knee replacement, and trying to do some heel raises will be a good way of trying to get some of that strength back. So I'm going to use a chair in front of me. You can do this using the back of a chair or your kitchen surface at home, and you're just going to roll onto the balls of your feet and then slowly back down. The aim is you're trying to get your heel off the floor as far as possible and trying to work through as much range as you possibly can. thank you very much for watching. I do hope you found today's video useful. If you have, there's some additional information in the description below the video that can help you manage your joint replacement and your arthritis better at home. And I'd love to hear from you. So drop me a comment below the video and let me know which exercise from today's video has helped you most. If you are new to the channel, then do hit that subscribe button so you get notified every time I release a new video, which I do every single week. And if you're feeling very generous, then please do hit that like button as well whilst you're there. If you have liked today's video, then you may also like the video that I have put together on the early exercises you need for a knee replacement. And there is a whole playlist on the channel about how to manage your arthritis better at home. Thank you very much for watching once again, and until next time, I will see you again very soon.